Hi all, in this video we're going to see about measurement of glomerular filtration rate. So again, this question has been asked multiple times in the different university exams, so we'll see how to write this answer for the exam and understand its concept. So why should we measure the GFR in the first place, or what is the importance of measuring GFR? It's because when we measure GFR, first of all, it's an indicator of glomerular function and it helps to assess the renal function. So, usually, if there is a kidney disease, before the creatinine level increases, it is the GFR that is going to decrease. So, it is useful in diagnosis and prognosis of kidney diseases, and it is also the basis for drug dose adjustment, especially for drugs which are excreted through the kidney. So we adjust the dose based on the GFR measurement. So with what do we measure the GFR? So to measure the GFR, we need an ideal substance, and there are certain characteristics for this marker substance. What are they? The substance used to measure GFR should be freely filtered at the glomerulus. It should not be reabsorbed or secreted. It should not be metabolized or synthesized in the kidney, and it should not alter the GFR. It should be non-toxic and easily measurable. So only if these criteria is met, we can actually measure the GFR. We need that substance to actually get fully filtered and excreted so that we know what is the rate at which the glomerular filtration occurs. So a substance that tick marks all these characteristics is inulin. So inulin is therefore the gold standard for measurement of GFR. So we'll see how inulin how inulin is used to measure GFR. So suppose this is the Bowman's capsule and the glomerulus. So inulin is a substance which is freely filtered from the glomerulus, which is fully filtered in the glomerulus. So what would be the rate of inulin filtration? That would be the concentration of inulin in the plasma, okay, into the GFR, right? The amount of inulin, that is, or the rate of inulin filtration would be the plasma concentration of inulin into GFR, right? Now, inulin is a substance which is not reabsorbed or secreted. So, whatever is filtered is going to be excreted, right? So again, what is the rate of inulin excretion? The rate of inulin excretion would be the concentration of inulin in urine into the urine flow rate. And see, because there is no reabsorption excretion, whatever is filtered is going to be excreted, which means the rate of inulin filtration is going to be equal to the rate of inulin excretion, which means plasma concentration of inulin into GFR would be equal to urine concentration of inulin into urine flow rate. So from this we can easily derive the formula for GFR, which is urine concentration of inulin into urine flow rate divided by plasma concentration of inulin. Okay, so this is how we use the inulin clearance to find out the GFR. So the amount filtered is equal to amount excreted, and GFR is equal to urine concentration of inulin into urine flow rate divided by the plasma concentration of inulin. So how do we actually do it in a patient? So first of all, what we do is we give an IV infusion to maintain steady state of plasma level of inulin, and then we collect timed urine samples. For example, every 30 minutes we will collect the urine samples, and then we draw a mid-period blood sample to know the plasma concentration of inulin, and then we will substitute these values to measure the urine concentration of inulin, plasma concentration of inulin, as well as the urine flow rate, and apply it in the formula. But see, this procedure is more cumbersome. It needs IV infusion and all. So that is why in a clinical practice they opted for creatinine clearance, because creatinine clearance is an endogenous marker. It is produced inside the body itself, and this also is freely filtered, even though it is slightly secreted, that we can omit that. Like it gives a rough value. It might overestimate the true GFR, but it is more easier to calculate GFR using the creatinine clearance. So the creatinine clearance, or the formula is the same: the urine concentration of creatinine into urine flow rate divided by the plasma concentration of creatinine. So because this is less cumbersome, it is commonly used in clinical practice. So here also the concept is the same. This is the glomerulus and the Bowman's capsule. See, we've got the creatinine coming in through the afferent arteriole. It is freely filtered, and for all practical purposes, the amount that is secreted is going to be negligible. So whatever is filtered is going to come out, or it is excreted. There is no, what do I say, no significant tubular reabsorption secretion of creatinine. So this again the same formula, creatinine, plasma concentration of creatinine into GFR would be equal to urine concentration of creatinine into urine flow rate, and from there we can measure the GFR. Okay, so that thus for measurement of GFR, the basic principle is the renal clearance method. The substances that are usually used are inulin and creatinine. We can also use urea, but urea usually underestimates the GFR when compared to creatinine. So this is how we measure the GFR. I hope this concept is clear. Thank you.